Fifth one, identify the equipment shown in the image below. This is also a favorite question. Okay, here you can see nasal prongs, but this image is very blurred. But this is the high flow nasal cannula. This is the important question. High flow nasal cannula respiratory support is used in the management of acute respiratory failures. Okay, this is the non-invasive type of support. This cannula delivers oxygen at high flow and high pressure through the nasal cannula. Advantages: it is very soft and pliable nasal prongs, hence comfortable to the patients. Reduces dead space because high flow of oxygen delivery clears the upper airway, and continuous positive pressure. HFNC, that is high flow nasal cannula, increases and expiratory pressure. Okay, that will reduces the work of breathing. When this is more, the work of breathing is less. Okay, warming and humidification of secretions. There in first question we saw, see, PEEP first 5 centimeter, then slowly increased. Okay, slowly we have to increase here. Yes, when this HFNC will increase this PEEP, so there is reduced work of breathing. So actually PEEP should be high, but we should be very careful, and because it may impair ventricular filling in the patients with blunt chest trauma. I have repeated just to make you remember. Okay, HFNC can deliver oxygen at 40 liter per minute, that is at 37 degree Celsius and 99% of relative humidity. High flow oxygen is delivered directly to the nasopharynx, hence FiO2 is nearly equals to traditional masks, that is non-breathing masks. Okay, there is a question related to FiO2 also. In that question I will teach you. Okay, sixth one, the cardiac output can be determined using the following: except thermal dilution technique, you can determine the cardiac output. Capnography is for end-tidal carbon dioxide. Okay, EtCO2. Esophageal Doppler also you can see the cardiac output. Echocardiography also you can see the cardiac output. The exception is B. This is also, capnography is also very important question. Is used to confirm the tracheal intubation and assess the ventilation in the perioperative patients. Okay, different pictures of the capnography also I'll show in next questions. Cardiac output can be measured by thermal dilution. This was given in the option. The dye dilution, lithium dilution, pulse contour devices, esophageal Doppler. This was given in the question. Echocardiography was given in the question. Thoracic bioimpedance. Okay. Sixth one done. Seventh one. The given set of instruments are used in. You can see here. This is the ambu bag. This is the ET tubes, Macintosh plate, you can see, nasopharyngeal airway, oral airways, Goodell's airway. Yeah, all the airways are present here. That means it is for the airway management. Laryngeal blade, this is the supralaryngeal airway. Coming to the eighth one, on your morning walk in the park, you notice an unconscious man lying on the ground. Which of the following option would be the next step? First, you have to analyze the question. First is, the patient is lying in a safer area or not? Yes, he is in the safe place. Okay, good. Now, He is unconscious. That means you have already seen the patient's response. So no need to check the patient response again. Okay. And he's unconscious now. So first next step is call for help. Okay. Start CPR and then calling for help is not advised. Okay. We need help before starting the CPR. Okay. So hence A is ruled out. After that, you can check for pulse. Yes. If pulse is not present, do CPR, defibrillate. If no pulse, okay, just observe. No, you can't do because he is unconscious, isn't it? Call for help and just see the pulse if it is present or not. Okay. D option, ignore and continue to walk. No, never. Even the layman's also can't walk like that. It's a humanity. You have to save the patient. Okay, let's see. Assess the safety of the surroundings. Yeah, is park assessed. Already it's assessed. Assess the patient response. Yes, he is unconscious and the patient response has been assessed. If unresponsive, shout for help. That is call for help. Yes. Assess breathing and carotid pulse. It should be done simultaneously, no more than 10 seconds. Active emergency response system. No breathing or no pulse, then you have to start CPR. Use the AED kit as soon as it's available. Okay. Check for rhythm, shockable, then give shock and continue CPR. If non-shockable, then resume CPR immediately. If no breathing but pulse is present, you have to give 10 rescue breaths per minute. Recheck the pulse every 2 minutes. If no pulse, then start CPR immediately. Okay, eighth one is done. This is the 2017 repeat. Okay. So here option is call for help, check for pulse, CPR, defibrillate if no pulse.